Welcome to the Sweet Life Coaching Podcast, connecting real people with expert advice to achieve a healthier lifestyle and live a more fulfilling and abundant life. Here is your host, Coach Tavia.
Well, hello, everybody, and welcome back to this show, the Sweet Life Coaching Podcast. I have another fabulous guest for you guys today. I'm super excited to bring in today Dr. Kyle Bryant. Hello, good morning, Dr. Bryant.
Good morning, Tavia. Thanks for having me on your show.
Actually, we call him Dr. Kyle. That's weird for me to call you Dr. Bryant, actually. Anyways, we are going to talk today to Dr. Kyle. He is actually a chiropractor in my local community. And we are going to talk about the connection between chiropractic and chronic illness, disease, and how all of that can play a part and how you can benefit from chiropractic. I know there's like a misconception out there. I know for me anyways, I've heard, a lot of people say, oh, you just go to the chiropractor when you have back problems. Well, that's kind of a false sense of what is actually true. So we're going to talk about that today. And I hope you guys will really get some nuggets of information out of this. But first and foremost, I want to introduce you a little bit and tell you a little bit about Dr. Kyle Bryant. So he's a chiropractor here in the Tri-Cities, Kennewick region. He attended Kamiakin High School. That's my high school. Go Braves. And he also is a graduate of Gonzaga University, and he went to chiropractic school at the University of Western States in Portland, Oregon. He graduated in 2012 and moved here with his wife, Desiree, and their 3 beautiful children. He also, what stands out about Dr. Kyle among most chiropractic is why he's so unique is because he's actually an integrative chiropractic. So his clinic is called ICE Clinics. I love it. It's Integrative Chiropractic and Extremities. I was very creative, by the way, Kyle.
Thank you.
And he represents the CCEP, which stands for Certified Chiropractic Extremities Oh my gosh, my Certified Chiropractic Extremities Practitioner. That's a mouthful. So he serves within like 100-mile radius, which allows him to incorporate arm and leg injuries and spinal dysfunction injuries as well. So it's really unique, you guys. So if you have like a broken ankle or a shoulder, a wrist, or anything like that, he is also is very knowledgeable about that. I know he's helped several people with just with other injuries, not just your back. So that's very cool. And total health here. We're talking about total health. So anyways, without further ado, we're going to talk about get going here and start talking to Dr. Kyle about some of these ways that you can benefit from an extremities chiropractic, and also how you can benefit if you are out there suffering from maybe a chronic illness, something else going on with you. And we're going to talk about how that's all connected. So anyways, that was a mouthful from me. Again, welcome.
Good intro. Thanks, Tavia.
Yeah. So, all right. So Dr. Kyle, let's just get started here. First and foremost, so you've been a chiropractor, you said around 10 years now. It's been, let's see, 2012. Yeah, about 10 years.
Closing in on a decade.
Yeah, about 10 years now. So awesome. And what made you decide, this is a big question that I've always wanted to ask you too. What made you decide to step outside of the realm of the normal chiropractic world of just cracking backs is what they call it. Sometimes they cracking backs to stepping outside of this extremities. Tell me a little bit about that, why you kind of went beyond that.
Sure. Well, I would say coming out of school, I was probably pretty conventional, a lot like most of my classmates. I went to one of the better chiropractic schools as far as being able to integrate into the medical community. But I didn't necessarily know how I wanted to use chiropractic, or if I wanted to have any specialties, any focuses like that. So what I kind of did was went with my background and my gut, which was playing sports. I was always very passionate about soccer, and was kind of driven in that direction in that regard. And then when my first job was over in Ireland, and over there, chiropractic is at least a good 50 years behind where it is here in the States. So I was treated in a way that I felt like kind of beat me down a little bit and made me question my education and how I was using it and what I was doing. So fortunately, when we moved back to the States a year later, I found a job in Spokane, Washington, under a doctor named Keith Morehouse, who really shaped my idea and mentality. And he was a CCEP, which I had no idea what or who that was at that time.
Right.
Anyway, so I was there for 3 years, and I earned my CCEP while I was there, and just got a ton of experience and wisdom passed down from Dr. Keith. And I think one of the most important things that he helped shape in me was he was willing to think outside the box and treat anybody that walked through the door. So even if chiropractic necessarily didn't offer a good answer, or anything that was in our scope of practice, he was always willing to do what he could do to try and help that patient. So I've certainly carried that on with my own practice since we started a few years ago.
Right.
And I think it's really developed here these last few years, especially with the angle of the extremities focus.
Yeah, no, and I love that. And that's one thing that was drawn to me. There's a background story of that, of course, with your sister, Katie. So just a background information here. This is a little side note. So Kyle has a wonderful sister named Nurse Caitlin, and she is my nurse that supports me with my Lyme disease for my doctor and Dr. Wakely in Seattle. And so she actually, one time I was up seeing Dr. Wakely, and she's like, "You need to go see my brother." And I said, "Great." So Dr. Kyle had a little bit of knowledge about, chronic illness, and and he gets all this information from his sister about, her patients and what they go through. So it was a really good fit for me. So when I was introduced to and first saw Dr. Kyle, it was a different kind of chiropractic that you did. And that's what really appealed to me. And so a lot of people, like I said, going back to when I first said in the beginning, like a lot of people think, oh, chiropractic is just cracking backs, right? That's kind of the old school way. They're cracking, you hear that cracking, and oh my God, they're cracking your bones and stuff. And that's not what it's about at all. That's such a misconception. And I want to clear the air with that today, because it's been night and day for me. I'll be completely honest, using you versus a traditionalist or someone who isn't, extremity certified. Sure. It has been definitely different. So let's talk about that. So I want to talk about the differences here of what you do, or what your philosophy or your strategy is, how it is a little bit different, and how it can benefit some people that don't think.
And are primarily focused on musculoskeletal health. And then there is on the opposite side of the spectrum, there's what they call vitalist chiropractors. And those are chiropractors that view the body as needing to have a perfectly functioning spine to make sure that all of our other health elements would we'd basically be in better health because our spine is ideally healthy. So there's kind of this broad range that chiropractors fall in. And I would say I would side more on the vitalist side of thinking in regards to treating patients, but I practice more in regards to a Western medicine focus. So I know that's a little confusing, but as far as my treatment techniques, but say like yourself, Tavia, or other people that come in with autoimmune conditions, chronic diseases, aside from aches and pains, there's usually some link to spinal issues and spinal complaints. So if you can appreciate that your spine is kind of the gateway for your brain communicating to your body through your nervous system, then you can really see how beneficial chiropractic can be for a good majority of people. I get people that ask me all the time, who's a good candidate for chiropractic? And I basically say, anybody with the spine. So a baby that's just born, a 90-year-old person that's trying to be healthy, someone that's super healthy, someone that's not very healthy at all. The same principles apply. And I kind of have the fundamental belief that you do need to have a healthy spine if you want to be healthy in general.
Absolutely.
So going to your point, as far as, is chiropractic just good for cracking backs? No, it's much more than that. And I think for lots of people with chronic disease, it really can be a difference maker for them.
Absolutely. But unless you're like me and you like to look at the root cause and dig down deep and find out, because I believe wholeheartedly fibromyalgia, there's always a root cause. For me, they said I have fibromyalgia, but I actually had Lyme, right? So let's just say someone comes in and says they have fibromyalgia, right? They have some aches and pains, they're tired, they're fatigued, they have some stuff going on like that. So, so let's talk about, what would you do anything different to them as far as modalities of helping them, or walk me through that a little bit, your modalities, because you do some special stuff. Yeah,
totally. I think so a good way to maybe understand my thinking when I go into a patient visit is that I'm not necessarily thinking in terms of diagnosis. I know I need to do that in terms of fulfilling my doctor responsibilities, but I don't like to pigeonhole people with a certain label, because then that label is usually associated with, well, hey, these are your options. So I like to go into it thinking outside the box a little bit.
Yes.
In regards to fibromyalgia, one concept I talk to patients a lot about is appreciating the difference between pain and nociception. Most people haven't heard of nociception. Nociception is the equivalent of a pain stimulus. So basically, if I pinched your arm, Tavia, there is the pain stimulus. Now, how your brain perceives that pain could be totally different from you, your husband, me, anybody else. There's lots of different factors that go into how we process pain, because that's a cognitive function that occurs in our brain.
Right.
So appreciating that someone with fibromyalgia that has lots of different pain points and perceived pain, there's a lot that goes into that, rather than pointing to where you hurt and then me as the chiropractor doing work where you hurt, kind of thing. So seeing kind of the bigger picture of why the pain is there, and also being able to reduce that stimulus, that nociceptive stimulus to the brain. And that's what chiropractors are very effective at with our modalities. Now you asked, like, what modalities would I use? Obviously, chiropractic adjustments, or what some people refer to as manipulations. That's kind of my go-to, because if you go back into the root of pain and nociception, there's also a theory called the pain gate theory that if you think of it this way, what's the instinctive thing that you do if you walk by the counter and hit your elbow on the counter? You rub it. So what you're doing is you had the nociceptive stimulus, and then you rub it to change the stimulus, and then you you perceive the pain differently. So with a chiropractic adjustment, the science of how it works is very similar to that, at least we think in theory. And that's why I think for a lot of patients, it can be very beneficial.
Yeah. Oh, I love that. That's a great analogy. Thank you for clarifying that. Yeah. So I want to talk a little bit further too, modalities. Yes, you do the manipulation too, but one thing that I love that you do in the office too, is you go through the whole body. So, you go through, like, you'll check my wrists, my shoulders, my feet, my hips. And you kind of intuitively kind of find, where I'm locked or blocked, if you will, in a way too. And that's part of being the extremities part, right? That's part of the additional.
Your traditional chiropractor, how we were trained was to focus on the spine, because it's the belief system that all issues are rooted in spinal dysfunction because of how our nervous system is intimately related. But I think what I've experienced, not only just being a CCP, but doing the global approach to treatment, say for like yourself, for other patients, is you kind of, you basically leave no stone left unturned. You're making sure that all components of the body, at least from my angle, are functioning properly, because anywhere that there's dysfunction, the body will find a way to adapt around it. And that's usually where a lot of aches and pains develop. So I'll see a lot of patients with shoulder pain. Say that same patient went to a conventional chiropractor. The chiropractor would probably say, hey, let's look at your mid-back, let's look at your neck, and those things will help with your shoulder, which I would totally believe that they do. However, if the shoulder is a rotator cuff injury or a capsular sprain, the nervous system component from the neck will certainly help that function and heal better. But if there's a hang up in the shoulder itself, you can only get so many results out of it. So from my approach, I take care of that neurologic component within the spine, but I also work on the biomechanical component of the joint or the extremity. So shoulder, like you said, shoulder, elbow, wrist, hip.
Feet.
And that, I think that gets a lot of relief for patients that have had lots of chronic ailments. I know I can speak to patients that have come in before. They've had good success with chiropractors, but not a complete resolution. Yeah. And then we focus on that extremity along with the spine, and that seems to get the majority of their relief.
Right. And that's what's helped me, to be honest. And just side note, yesterday I saw you and, I was telling about my wrist. My wrist actually feels tons better today. Thank you very much. Oh, cool. It does feel tons better. So, and that was just a thing, guys. So another thing, like my wrist was kind of bothering. I'm like, can you kind of work on my wrist or something? I got some arthritis a little bit. It's from Lyme, unfortunately. But the thing that's really great is that, again, going back to what has helped me is like, so especially Lyme bugs, they like to live in the joints. A lot of people don't know that. Knees, ankles, wrists, elbows, shoulders, things like that. Well, we have joints all over, but back is a joint as well. But long story short, so that is going back to the full circle here of how I wanted to bring him in, that is why it's kind of helped me too, is opening up those channels. Now, here's a misconception that a lot of people say too, when you hear that cracking of the back, it's not bones, right?
Yeah. So
tell people what that really is. Tell people when they hear that sound what that is.
That's a good point, Tavi. Yeah, I think some people are actually nervous to see a chiropractor because of that exact concept. They've heard that you're breaking bones, cracking bones, or maybe they just don't even like the noise in general. Right. Our best running theory right now, what they suspect is going on is your joints are gapping, and you have a little vacuum pressure inside the joint with a viscous fluid they call synovial fluid, and when you gap it to a certain degree, it'll kind of make this what they call a cavitation, which a lot of times I'll tell patients is kind of the equivalent of popping a pop can or a champagne bottle. Right. It's kind of that vacuumed pressure, and then you release it all of a sudden, and it makes that nice noise. So a lot of times I'll tell patients the pop is not so much what we're going for. We're going for specific and precise movement of your joints. Right. But the pop for some people can be very relieving, but like I said, at the end of the day, it's not necessarily what we're going for.
No. Yeah, because sometimes I won't hear anything, and you're like, no, but you're still moving. You still kind of feel some movement. So the another thing that you do that is different and unique that I love is after we see you, we go to PT. A little physical therapy moment. And it's not long. It's not like you're going for an hour or anything, but I love that concept that you have extended your services and now you have this wonderful laser, which is amazing too. And I've had some good results with that. But the thing that I think is really another unique concept they did was having that PT after. Because I know sometimes in the past I've gone to a chiropractor and I leave there and I'm kind of like, I'm a little bit sore. I just don't feel complete, And so the PT that you offer is really cool. And guys, I want to share this. It's like, what? I'm going to physical therapy next? What? No, not necessarily that. It's you determine kind of what's going on with that patient that day and do a little bit more added services. And from that, I mean, like you do like cupping for a little bit, you'll do some scraping of the muscles, you'll do a little bit stretching, some massage work, something that kind of leaves the patient with an overall sense of completeness, I guess is a good word. And I really think that's awesome. A really cool concept as well. I think that's awesome.
I think that's, as far as how I view treatment, I think getting the adjustments kind of the hallmark, because that's more or less where you're unlocking a patient's ability to move a little better. And then that's going to in turn feed their nervous system. However, as many of you that are probably seeing a chiropractor, you still have your knots and your tight spots afterwards. So to just facilitate the benefit of the adjustment even better, that's kind of why we think in those along those additional services.
Right. Yeah. So again, going back to someone who is having a chronic autoimmune disease or something like that, it's full circle. I feel like you're getting a complete kind of service in there. And I love that. And yes, I'm plugging you a little bit here. I'm just going to be honest, guys. I'm plugging Dr. Kyle a little bit because he has really helped me. And I believe in supporting our local community. Dr. Kyle has been amazing. He's sent wonderful clients back my way. And so we have a really good, I would say, business relationship. And I really appreciate you for doing so. Thank you. Yeah. But let's just kind of wrap this up here. So if you were to for the listeners out there, if for a listener that's like, you know what, I'm still not sold on chiropractic. You guys are cracking my back. You guys are going to mess me up and I don't need a chiropractor. And someone who's never seen a chiropractor, what would you say to them to get them to understand that it's not going to hurt? You may just feel a little bit better, what would you say to someone like that? Because I'm sure you've had some of that,
Oh yeah. I mean, I think, like you alluded to before, there's lots of misconceptions about chiropractors out there.
Yeah.
I think one of the best things to say in regards to chiropractic is considered a conservative approach to health. So especially when, one of our top causes of death in the U.S. and in Western medicine in general is just traditional medical intervention. I think people are stepping back a little bit and maybe saying, okay, what are my options that are a little less potential risk, a little less side effect associated with it? Lots of people are kind of given medications, which they provide a list of side effects that maybe they need another medication for, and blah, 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 blah. So as far as chiropractic is concerned, a chiropractor should never be putting you on a medication. They should never be cutting you open. And ideally, they're never looking to direct you along that path either. So they're trying to take a more conservative approach to your health and asking the fundamental question, which lots of functional medicine practitioners can appreciate.
Yeah.
Where are you deficient as far as vitamins, minerals, or especially in the case of chiropractors, where are you deficient in movement? And where are you maybe toxic? Where are you getting too much of stuff that you don't need? And the entire idea is you're basically trying to get the body back to balance, back to homeostasis. So as far as chiropractors are concerned, and to go back to your question, Tavia, I think it's a really good option for people that are looking to step outside the box and to improve their health, whether they consider themselves healthy already or they're looking to make some big changes. It's a really good starting spot. And I guarantee you, you can go online and look at reviews, testimonials, case studies all over the place. And there's some really cool stories, success stories with patients that were kind of at the end of their line, didn't know where else to turn. They saw a good chiropractor and then they kind of got put in a good direction. And I think one of the neatest things to hear people say is that they have hope again. So especially when you're encountering chronic disease and you're working with patients with chronic disease, that can be a tough thing to come by and to try and keep and maintain. So,
No, I love that. One last thing I just thought of when you're talking to, I remember one day, and this is a good example to the listeners too, of how you really helped me one day. And that was my gut was off. I was having some gut issues. And when the gut is off, my psoas muscle was really tight, if you will. And in turn, it threw off my SI. I don't know if you remember this or not, but I came in to you and I was like, and I got an adjustment and it was like not working or something. And then you're like, and you dug around and you were like, it's your psoas. And you got in there with the little gun thing, and not a gun, guys, not ammunition gun, like a massage gun, just for clarification. And you were like, I think it's your psoas. And so you worked on my psoas and then kind of moved me around again. You're like, okay, go walk. And I was like, good as new. So, those are the things people don't think about. Muscle affects structure too. We got some tight muscles going on. Your muscles are going to be your bones or your structural is going to get thrown off. So my gut was off. And here's the connection going back to the chronic illness, going back to disease, going back to whole body health. If the gut is off, there's got to be something going on misaligned in the spine or some muscle, something going on there too. So it's all connected. And that's, and I feel like that's something that people don't really understand. Like they were thinking about their stomach. They don't think, I'm going to go to the chiropractor. Another story, you don't even know about this, but my baby cousin, she's not a baby anymore. She's 11 years old. She's a gymnast and down in Boise, big gymnast. And she was having all these gut issues, again, stomach issues. They said she had celiac, all this stuff. She was having so many gut issues. I told her mom, I said, go to a chiropractor. And they found an extremities chiropractor like yourself in Boise area. And she now can eat better. She's doing great. She has no more stomach problems. And she did a good year of treatment with him. And she's doing great now.
Awesome.
Isn't that cool?
Awesome. Yeah. And I think you said it perfectly. It's all, if you can appreciate that it's all intertwined, everything is connected. You know, I'll have patients ask me all the time, was that a muscle? Was it a joint? Was it a bone? Like what was the issue? And the answer is usually all of the above.
Right.
And a good chiropractor will usually appreciate that what you're ultimately trying to do is influence the brain. And if you can appreciate that your body influences your brain with input, and then your brain takes that input and makes output, you can see how your bones, joints, ligaments, tendons are intertwined with the movement of your viscera and your organs as well.
Right. I know I wanted to wrap this up, but I keep thinking of other things too. This is so funny. Parasympathetic state.
Yes.
And sympathetic and parasympathetic state. Another terminology that's a big word for probably people never heard before, but one thing that people need to be in is a parasympathetic state. And basically that means in a not fight or flight response, right? You're in a rest and digest mode, if you will.
Yes.
Correct? Isn't that a good way of explaining it? And that's another thing that chiropractic does. It puts you in that state. Yeah. Yeah.
I think your sympathetic nervous system is part of your autonomic nervous system, and you have a parasympathetic part of that nervous system. And just like you said, one is fight or flight, one is rest and digest. In a perfect world, we would be equally balanced. Right. But in today's world, because we have so many perceived stressors around us in our environment, our food, lifestyle, we're burning the candle at both ends, basically. Right. And so a lot of our health issues, I believe, are rooted in that imbalance. So one of the points that I'll make to many patients is, I think, what would you think is one of the worst stimulators of your fight or flight? Tavia, you can probably appreciate this.
What is my worst stimulator?
Well, what could you think? Like for most people, what's
stress.
One of the most?
Just
stress, exactly, and pain.
And pain
is one of. Imagine being in constant chronic pain. There's no way that your body is going to apply its energy towards resting, relaxing, and chilling out. So, say you take a person that's already burning the candle at both ends, right, and then they're experiencing pain because they have these structural issues. A chiropractor can really help remove the painful stimulus and allow that body to get back into more of a restful state. Perfect.
Yeah. And that, again, comes full circle of what we talked about in the very beginning of, again, a lot of people with fibromyalgia, chronic fatigue, a lot of those autoimmune conditions are in chronic pain, and if you're in chronic pain all the time, and Lyme too, you can't get into a healing state as well, right? If your body's always inflamed, if it's always PO'd, it's not going to get into that state. So absolutely. Yeah. So again, guys who are listening out here, if you have not tried an Extremities chiropractor and you've tried a regular chiropractor, and no disrespect to any of the fabulous chiropractors in our town, because we have some great ones. I want to definitely say that there's amazing chiropractors out there. No, there's no right or wrong here. It's what you choose and you decide. But I just want to emphasize the differences, and I wanted to share that today. And so I thank you for coming on and explaining that and the differences and what you do and the fabulous things that are available to people in the community to try.
Thank you, Tavia. I really appreciate that. Really appreciate the shout outs. And I think what you're doing for the community, you're certainly bringing something unique and helpful. And just like we've discussed before, being able to offer that circle of practitioners to better take care of people's health, I think is the ultimate goal.
Absolutely. Yeah. So Dr. Kyle, how can people find you if they want to make an appointment with you? Shout out to what's the best way? What's your phone number or email, website? What's the best way to get a hold of you?
Well, like you said, we're a little bit confusing to get a hold of because we go by multiple names. We go by Integrative Chiropractic and Extremities is our full name, but that's obviously a mouthful. So some people refer to us as ICE. Some people refer to us as ICE Clinics.
Okay.
Our website is www.iceclinics.com.
Okay.
Phone number is 509-820-3828. And we're located, tucked in a little bit behind the Toyota Center there in Kennewick, but we have multiple ways of getting a hold of us. So if you need our help, just get a hold of us.
Awesome. And also I wanted to say too, you guys can follow him on Facebook. You do have a link on Facebook, and you always do a tip for Tuesday, which is awesome. If you guys if anybody's on Facebook, go to Facebook and just follow him on ICE Clinics as well. He always does a nice tip. And one thing too, like I said, it's not just all about chiropractic. What he talks about total health. And again, that's another reason why I simply enjoy working with you as well, because that fits right along with what I do. So, all right. Well, thank you so much again for being on my show, you guys. And if anybody wants to reach out to Dr. Kyle, you have his information. Thanks again for being on, and everybody having a great day. Take care. Bye-bye. Okay, bye-bye. Bye.
You've been listening to the Sweet Life Coaching Podcast. To learn more about the topics mentioned on today's show, please visit sweetcoachtavia.com.